Hi, Russ back again. If you didn't know, I'm doing all of these videos basically one after another. It would have been, I know a lot of people, you'll find people who post like, yeah, this is my video from day one or day, etc. So I'm just going to do a recap from, I've already talked about why I chose surgery. So I'm just going to talk about, the day of the surgery up until through today. And again, I mean, it goes without saying, but everyone's experience is different. I've seen a lot of people, like for instance, the sore throat, right? They basically go in, they make the incision, pull everything apart. Of course you're gonna have a sore throat, right? But I've heard some people, like one lady said, gosh, I've had colds where I had a worse sore throat, Other people like, my throat hurt really bad, so it runs the gamut. And it doesn't, at least in my case, any discomfort, and I would call them 3 lowlights I had. Didn't last that long. I think I had it on the 14th of December 2018, and I feel really pretty well today. So the day of the surgery, like any surgery, you fast the night before, and fortunately I had an early appointment, so I didn't have to wake up starving or anything. Any surgery like this, you have to have a support person, and my wife, she's the best. My awesome, lovely wife took me, and it was outpatient surgery too, by the way, which I think not all doctors do that. I think some doctors do like to have their patients in the hospital. I don't know if it depends on the nature of it or whatever. But in where I am, it was in an outpatient. It's fascinating to me what they can do on outpatient today. But so went to the appointment, and obviously you would not be human if you weren't at least a little scared and anxious. Was I scared and anxious? Yeah, I'm human. So you get in there, you fill out the forms, you're feeling a little bit nervous. I guess the good news is they, about halfway through getting you prepped, they give you happy pills. And it was, I'm not sure exactly everything what was in it, but one of them was Dilaudid. So I went from feeling a little bit tense, a little bit anxious, to feeling kind of happy. Almost giggled a few times as the doc came in to talk to me. But and I think it's important, right? I was able to sleep well the night before. I didn't particularly worry about going to bed early. I figured, hey, I'm going to be knocked out most of the next day, whatever. If you're getting your surgery coming up, I hope you can get a good night's rest ahead of time. Hopefully videos like this put you at ease so you feel a little less anxious too. I would hope. But so anyway, getting back to they gave me the Dilaudid. I was kind of in a happy mood. My wife came in, doctor came in, and it was interesting because he hadn't shared this with me prior. But the one thing he warned me then is, he said, listen, he said, I'm about to put your neck in a more anatomically correct position, right? Because, excuse me, as my disc degenerated, my head had, your head ends up tilting forward. It's not the ideal position. However, your traps, all your muscles back here are now used to that position. He said, now when I put these spacers in, and now all of a sudden your neck kind of gets back into this normal position, your muscles are gonna rebel. So, and at that point he had told me you're gonna get meds for pain management. But I guess the way he put it was the workhorse is going to be the muscle relaxers. He said, because you're going to spasm. And sure enough, he was right. But it was the cool thing about it, and I when I talked to the doc afterward, he said exactly, you know, the case. It was a little bit like, almost felt like that same pain that I had, like why I got the surgery in the first place. However, it was on both sides. It was completely symmetrical, so it was everywhere. And he said exactly, it's a different mechanism, and it went away after a few days. But he definitely said, and again, you're going to go by what your doctor says, but he said that the muscle relaxers were going to be the workhorse for the recovery. Pain management would just be, you know, as needed. I will say this, I didn't have a good experience waking up after my surgery. I've had that, but I really think there may be something extremely unique to me, I think, because I don't know about if you've ever had wisdom teeth out, for example. And they always tell you, if you get your wisdom teeth out, someone has to come and they have to drive you. And I picked up a friend of mine, and he was like loopy and whacked out for like several hours afterwards. I think my son, when he had his, he was a little bit loopy and whacked. When I had mine, I was like, the minute they said wake up, I felt completely normal, completely like it was 100% out of my system. A couple of other times I had anesthesia and kind of felt the same way. I think one time when I was young, teenager, I remember and everybody complains about that groggy, druggy, really weird, not a good druggy feeling of anesthesia. I think I remember having that once when I had my tonsils out. But other than that, when it's time to wake up, I feel like it's out of my system. So my theory is that while most people, the anesthesia would have still been providing some pain support, when I woke up, it felt like I had nothing. And I felt like I got hit by a train. I mean, my head hurt, my neck hurt, everything hurt. I don't want to scare you all out there, but like I said, I think that was kind of unique to me. Bottom line was, I just told the nurse, hey, I am really uncomfortable. I don't know what they gave me, but they gave me something, and 20 minutes later I was fine. Again, that was just my personal experience. The rest of the day of the surgery, I actually felt pretty good. I was kind of amazed at how good I felt. My wife and I went to the CVS to get the prescription filled, and while we waited, walked around a bit. That's the one thing I'm quite certain your doctor will say the same thing. They want you up and about, walking twice a day. I think it's to clear your lungs, that get any of the anesthesia out of your body. I think it's mainly related to clearing your lungs from post-surgery. And I think my doctor doesn't want me to move my neck and stretching, nothing of that nature, just walking. And I'm quite certain you all have a similar advice. Obviously, go with what your doctor tells you. So again, for the rest of that day, I felt pretty good. Day 2, I was starting to experience a little more pain. The sore throat kind of kicked in a little bit more. Again, to be expected. The odd thing was, I was prescribed oxycodone, which nowadays with opioids is scary, but the doctor assured me, he said I could have even had a refill and it still wouldn't be an issue, but he prescribed that. I started out with 5 milligrams, didn't feel like it was doing much of anything. I went to 10 milligrams, and so my surgery was on a Friday. Saturday, I started to feel a little bit uncomfortable. Had gone to the 10 milligrams, and was really feeling like, gosh, this isn't, like, I didn't feel affected at all, if you know what I mean, and I kind of would have expected. My doctor, I think he called me about 3-4 p.m. that day after the surgery, And by that time, all of a sudden, I kind of did feel a little bit loopy. So the pain went down. I brought that up to him, and he said that sometimes it takes a little bit for it to be in your system before it's effective. So maybe that's good information to know. I don't know. So anyway, so that was day 2. And to go back to day 1, I slept pretty well. My doctor was fine with me sleeping on my side, sleeping whichever way I wanted, so long as I wore a collar. From my understanding, what I've seen on YouTube, from what other doctors post and people, I think most doctors want their patients on their back. My doctor said on my side was fine. I'm a side sleeper anyway, so that was kind of good for me. By the second day, I was doing okay, feeling pretty good. Took some naps during the day. When I went to sleep, going from the second to the third day, I started to have a lot of mucus. Later I took some Mucinex, I don't know if that helped, but was having a lot of throat pain, and just I got up in the night a lot. Now, I'm not in the best of shape. I think if a younger person or any person maybe with better core muscles might have less of a problem than I did, but it was really hard for me to get up and out of bed without engaging my neck muscles, and especially the muscle here adjacent to the wound. That started to really make that hurt. And again, I think it was just getting up out of bed and in and out. I think I must have gotten up like 6-7 times. So I started to experience more pain. I think I even took the pain medicine in the middle of the night because I was up so much and I was in discomfort. So day 3 was kind of like not a good day. Felt like it was really difficult to eat. My throat was very sore. It was kind of hard to swallow. I tried to do like a protein shake. I probably should have been a little more diligent. But I think mixed in with the oxycodone and the Valium, not eating a lot, I just was not a happy camper. I wasn't feeling good. I did do my 1 walk in the morning, but that was about it. And just kind of, I almost felt like I had the flu. I started worrying, like, am I sick? Because it was that kind of like just, again, it was 1 day. So day 4, I actually started to feel a lot better. My throat still bothered me, still had a little bit of the mucus feeling, but I could swallow. It was still a little uncomfortable. I guess thinking back to it, it was kind of akin to having your tonsils out, if you had them, that kind of feeling where it's just really like a chore to swallow your food. But day 4, I was really trying my best to eat more. I was drinking lots of water. Started to feel like I was doing better, but gosh, by the evening of day 4, I started to feel really nauseous. I figure I just bring this up just in case this happens to you, because I had a lot of anxiety about that, because I kept thinking, what happens if you throw up? I'm not supposed to move my neck, and generally when you throw up, it's sort of kind of a lot of involuntary things can happen, and I really was like, what am I gonna move my neck in such a way that it's I shouldn't do? I guess the good news, bad news was I did end up vomiting. It wasn't a big deal. Didn't bother my neck. It made me feel a little better, and so that was really like my 3rd low point. So here I was at day 4. I had the 2 bad days, and believe me, if you watch a lot of YouTubes, there was one lady, I think by day 2 or day 3, she was like, I'm fine, I'm ready to go. So again, everybody's experience can be different. I think my big mistake was I needed to do something to get whatever it was, liquids, something on day 3. I think that was just kind of my own issue. day 5 until today. So again, today is December 26th. I had it on the 14th, so 12th day. Since that kind of low light day of day 4, from day 5 to day 12, I feel like I've just been feeling better and better. My doctor wants me to wear my collar for 3 weeks. I have my first post-op appointment 2 weeks out, which will be this coming Friday. My throat may be just a tad sore, really not a big deal. Let's see, so that pretty much takes me from the day of my surgery up until day 12. I've been able to sleep a lot. I hope and pray for your sake, if you get the surgery, you can, because I know some people have posted that's a problem for them. Hopefully it's not for you. Gosh, I had one day where I slept over 12 hours. I don't know the last time I did that. If I can take a nap during the day, I take a nap. I'm not going to work. My puppy's trying to get in here. The other biggest, I should probably mention, the other biggest hazard for me coming back from surgery is we have a 10-month-old black lab, and boy, she likes to jump on all of us. So that was probably the biggest hazard I had to deal with, but she was fine. She seemed to figure out that she needed to go a little easy with Papa. Alrighty, so this is our puppy Basie. Basie, easy. Daddy's got a bad neck now. Take it easy now. So before I sign off, like I said, I'm going to try to do the follow-ups, but I hope you have, if you do the surgery, you have a great result. And if you have similar type issues of pain like I had, hey, if you can knock it out with PT or something else, definitely do that. Explore your options, and I wish you the best. And again, hopefully this blesses you. And my thanks to everybody who had posted things, videos like this that were extremely helpful to me. So God bless you.